Welcome to our Facebook Live. Happy Monday, Kitty, and we have Dr. Bales this evening. So I'm going to read you something that's really important because we're really wanting to connect with you and make sure that it's all about that connection. Especially going into 2019, we want to wish you happy holidays with you and your family and your friends and let you know that we share that love with you. So welcome to our Facebook Live. Dr. Keneally and our clinics have a mission to address the international emergency of cancer. Our goal is to educate, empower, illuminate the cure for cancer, which is prevention. The cure for cancer is prevention. So, of course, we already have almost 50% of people being diagnosed with cancer every day. 1,600 people die a day, but no one says anything about it. How can that be? But they just don't want you to know. But at Cancer Center for Healing and Center for New Medicine, we want you to know. We need your help. We need your help by spreading the word about this cataclysmic situation and the solutions. We can change things. We really can if we all work on this. We all need to empower ourselves with the information that will change the course of so many of our lives. Community is the way to do it. And we want it to be contagious. We want to create a contagious community with you and your family and your friends. So each one of us has a gift. And we have a gift and we have the power. What better gift than the gift of life? The last time we looked, it's not available on Amazon or any of those type of stores. You can't buy the gift of life. But we want to provide that to you. Once health is gone, it's very hard to get it back, and sometimes we can't get it back. We lose the life itself with a disease that could have been preventable. So no one knows this, it's a secret, but we are trying to get that secret out to all of you. So thanks in advance for everyone who's doing this, who's been living a healthy lifestyle, who is sharing the word, and I do pray that all of you share it with your family and friends, and welcome everyone here with Dr. Bales.
Thank you, Kitty.
Thank you.
Well, as Kitty just mentioned and Dr. Keneally has said before, 1,600 people a day. So let's think about it. If there were 3 large, I'm talking like 747 or large Airbus aircraft that crashed every day in the world, do you think you'd hear about it? But do you hear about the cancer? No. So obviously a lot of information is being suppressed, a lot of healing, a lot of natural products and cures are not being known to the public, and that's not why I'm here today, but I think it's good to echo and reverberate that information for you and your friends. It could just save their life one day. So starting off with a little bit of my background, I started working when I was very young at my dad's small company. I was the automatic intern every summer, putting parts in printed circuit boards when you used to have to hand put parts in boards back in the early 80s. And I developed an interest in engineering and was always science and math background minded. So for college, I went and achieved a degree of electrical engineering with systems engineering at University of Virginia. When I graduated, I started working with circuits and everything in a back room, and I thought, you know, this is good. I'm happy, but I'm not as happy as I could be. And I really enjoyed working with patients. When my dad started selling medical devices in the early 1980s, I would sometimes go along as a kid to help install the machines, the thermography machines. My dad invented the digital infrared camera, and train the nurses and the staff and the doctor at the doctor's office. And I always liked that from the time I was really little. My dad developed what was called the photonic stimulator, the first of our light therapy devices 20 years ago, in 1998. And it's hard to believe it's been 20 years, but it's been a big evolution. And similarly with the infrared cameras in the 80s, in the later 90s and early 2000s, I would help install and train the nurses and staff at the clinics and actually treat patients, because the best way to train somebody is to treat their own patients, and I just loved it. So when I graduated from Virginia and was back with my circuits, I thought, you know, it'd be really neat if I could merge both together, because I had gone and paid for the engineering degrees, and if I could get into health, because the bridge was my dad's medical equipment. So I looked around, and the best degree for me likening the body to just a bunch of circuits was acupuncture, because acupuncture and the theory of Chinese medicine is that we have meridians that run through our body, like freeways down here in Southern California, and when the meridians get blocked or backed up, just like sitting in traffic on one of our freeways, we have pain. It's painful to sit in traffic. So that seemed to be the best correlation. So I went and achieved a master's and a doctorate of Oriental medicine. And a couple years ago, I started my company with my dad, Bales Photonics, and we are happy to announce the launch of our newest photon. And as I said, this first came out in 1998, so it's been 20 years of evolution. And in very quick trials so far, in the past about 6 months, we have noticed that due to the increase in power of our machines, and with the integration of frequencies and different wavelengths, different colors of light, we are actually able to treat cognitive disorders and cognitive deficits such as dementia, Alzheimer's, and even some Parkinson's patients. So this is brand new. We haven't used the devices for this before. We believe that because of the increase in power, wavelength, and frequency, we're actually able to permeate part of the skull and actually address the brain and the central nervous system directly. When I started researching, I thought, oh, we're probably the first people to do this. Well, this isn't new. This work has been performed back into the 70s, obviously with technology that was available at that time, using different wavelengths of light to help with central nervous system disorders. So our new device is down here. We decided to call it the Firefly, and it's Firefly Light Therapy. I just was back in Michigan installing a machine like this at a clinic north of Detroit that's going to be helping us with some trials for dementia. We also have trials going in the San Francisco Bay Area and down here in Irvine, Orange County in Southern California. So starting in the new year, we're going to be enrolling patients who have a clinical diagnosis, an actual diagnosis of dementia. Not just someone who can't remember where they put their pen or their phone or something like that, but an actual diagnosis by a neurologist. The trials are going to be run probably for about 6 months. We're hoping to run about 25 patients through. So if you, loved one, a friend, a coworker, or somebody, or know somebody who has that actual diagnosis of dementia by a neurologist, you can please contact our center. And if you know someone in the San Francisco area and the Detroit metro area, the same, you can contact our center and I will forward the information. So that's about the trials. We're very excited. As I said preliminarily, we've been reversing people's life. They get their sense of humor back. They get their quality of life back. They become the husband, the wife. Even scary now, people as young as 40 have been diagnosed. So the daughter or the son that they once were, that through the years and through the cognitive decline that they've lost. That's really sad. So a little bit about how this works. I mentioned the increase in power level. My father's first machine, the photonic stimulator, came out in 1998, and it was 240 milliwatts of power. If you're not technically minded, don't worry about milliwatts, just say 240. And it was one wavelength, one color of light, which was infrared. Infrared's invisible to our eyes. And we thought we did pretty good with it for pain management and soft tissue injuries, wound healing, and the like. So 240, well now we're at 37,700. That's right, 37,700, and we're combining it, that's combined of 8 different wavelengths of light. We have reds, we have blues, and we have infrared. So why the different wavelengths? Why not just do infrared? Infrared permeates deep into the tissue. Well, we found that through the years that the blue wavelengths are really good for skin surface conditions. They're good for wounds. They're good even for hair regeneration, which we're not making that claim. Others have made that claim. They're good for burns, cuts, and contusions, all very surface, dermis, subdermis, and epidermis level. So that's for the blue. The red is found to permeate well about 1 to 2 centimeters, up to an inch, about 2.5 centimeters, depending on the power, into the body. So it's good for deeper cuts, deeper burns, deeper kinds of injuries from trauma and that. And as I mentioned, the infrared, which is invisible to our eyes, permeates up to 20 centimeters, which is about 8 inches into the body. So we can work on organs, say from someone that's had a major car accident or any kind of major trauma. We can work on deep traumatic situation diagnoses. So the benefit of having all 3 in one machine is that you're working at all the different layers at once. If you compare this to a laser, lasers, the class 4 lasers have very good power, output power, and that most of them are either single wavelength or double wavelength, or someone has to purchase a red laser, a blue laser, and infrared. You can have them all at once. Not only do you lessen treatment time, but you lessen cost, which then is less cost to the patient. The treatment does have a few contraindications. We won't treat anybody that's pregnant. There's never been a problem in the past, but just for safety, we said no pregnancies. And then we always have patients wear safety glasses. Everyone in the room wears safety glasses, just because the visible output, the blue and the red, are very bright. We've never had any problems with eye damage. This does not use a laser. This is a high-intensity LED chip, which we had custom designed for us for Bales Photonics, and just for safety. So those are the two. But if you look at contraindications of other devices, that's pretty minimal. We can still treat quite a few people. As I mentioned in the past, the photonic stimulator and our past model, the biophoton, were used for pain. The Firefly can also be used for all kinds of pain management: chronic pain, acute pain, neuropathic pain, non-neuropathic pain. Pain, especially chronic pain, is best monitored by taking a thermogram, the infrared or heat picture of the area as a pre-treatment to see, kind of give a roadmap of what's going on. For example, if I were to take a thermogram of someone with back pain, I could determine if they had a herniated disc or if they had a pinched nerve, a radiculopathy, within seconds. And I could know where to focus this Firefly treatment on the patient. And then if desired, after a series of treatments, another thermogram can be taken to determine the lowering of inflammation levels. Say if it was like a herniated disc or a pinched nerve, would be a level of inflammation before, we could determine after. Usually when patients feel better, they don't ask for a post image, but if you're doing a study or something like that where you want to capture some data, that is available because it's objective. It's temperature data, it's objective, not subjective. The other role of thermography in using it with pain management devices, and I say Firefly, but also in this clinic I used a couple different kinds of PEMF, pulse electromagnetic field therapy, and also, as I mentioned, my doctor is an oriental medicine, so acupuncture, so I can combine them well. The Firefly goes really well with those, either alone or as a multi-therapy. With the thermography, you can use it as a roadmap for referred pain. So the classic case is a patient comes in and they said, I have pain in my wrist, I've been to every hand specialist in town, and the pain is there, nothing makes it go away but taking really harsh drugs. I don't want to take the meds, they make me feel loopy, they make me constipated. I said, okay, so why don't we take a thermogram? Well, you can take a thermogram of the wrist and compare it to the other side, the good wrist, and of course it's more inflamed. Okay, so it's there, and you can say, well, we'll just treat the wrist, but everybody's already done that. I take a thermogram of the cervical spine, the neck, and see that they've got a radiculopathy, a nerve impingement on the same side. So the problem is in the neck. So you can treat the wrist with whatever, acupuncture all day long, and you won't solve the problem. So thermography is really good at being able to track referred pain patterns, and the same goes for the feet, and those nerves are wired, like we say, electrical engineering into the low back, so we can track referred pain patterns. And the thermogram is very simple. The room is just slightly cooled. There's no radiation or x-rays or need to take any contrast dyes. Thermography is not a substitute for structural imaging, such as MRI or x-ray. Those have their place and are very good for showing structure. Thermography shows physiology, which is basically body function. So we can see what the body's doing about an inflammatory process or a problem. And the other, one of the many patents my father has, is actually using the thermography live while treating the patient with a device such as the Firefly. I've also done it with acupuncture. So you can take a pre-image and put it on one side of the left side of the screen or one side of the screen, and then have a live rolling image and use the device and watch the blood changes change dynamically in real time. And the patient can see that too, so they know that the therapy is actually working for them. So there's a lot of ways to, as I mentioned, you can do it with acupuncture, you can do it with PMF, you can do it with other therapies as well. So we're very excited. A little bit about the frequency. For those that saw my last podcast, let's see, our Facebook Live event, I think a month and a half ago, I was talking about the F-scan or full scan. And what we've noticed, and the reason that I purchased that device also and have since kind of married it to the Firefly, because using the full scan, we can run and do a full body scan and it'll come up and tell you exactly what frequencies certain organisms that we all have, nobody's totally clean, living in us, viruses, bacteria, fungi, and the like, and actually give the frequencies of those. Well, we've made the Firefly can hook up to a function generator, frequency generator, and we can program those frequencies in so we run them through the light. For those that are familiar with Rife and his theories and his demos back in the 40s, and if you're not, you can just YouTube Royal Rife, Royalrife, and see what he was up to. It's frequency therapy using light. He had big light tubes. We have a new designed LED chip, but it's the same idea. So that's another big difference between our previous photonic stimulator and biophoton is we can run frequencies. So like we believe that a lot of the central nervous system disorders, like dementia and Parkinson's and Alzheimer's dementia, are caused from a lifetime or a heavy load, bug load, a heavy load of viruses, bacteria, fungi, molds, and that. And that seems to make sense logically. Not just central nervous system, but cancer. Certainly, if someone has a high bug load, their immune system is going to be suppressed for, I'm talking like 20 years, and it's not going to be able to fight off the start of a cancer, a small tumor or something, and it's going to leave it unchecked and let it grow. Same with central nervous system disorder, same with a lot of other neurological diseases. So that's a theory. The more research I do, the more I'm convinced that if we can lower our bug load, by using devices like the Firefly to help resonate the bugs and destroy them. Also, obviously, clean diet, clean water, clean air, as hard as that is to come by these days, that we can lower our incidence of chronic disease, such as cancer and these devastating neurological diseases. So I'm offering the F-scan and Firefly treatments here now at the center for pain and for parasite discovery and also ablation. And as I mentioned, the dementia trial will begin in early 2019. And we're really excited about that. So I think I've talked enough. Do we have any questions out there?
So we have a couple questions.
Okay.
The first one is, can Firefly help me with my joints?
Okay, the question was, can Firefly help me with my joints? Absolutely. I have treated arthritis, and there's lots of different kinds of arthritis, and even autoimmune, which is rheumatoid arthritis, with the Firefly. Now, the autoimmune, the rheumatoid is more difficult, but and the Firefly, I say Firefly, I mean the technology, photon stimulator, biophoton, because Firefly just came out, like I mentioned, it's just more powerful, so the mechanism of action is similar. What I can treat it, what else we want to look at for joints is the acid alkaline levels, and you can get the test strips at any drugstore, or probably on Amazon online, and usually patients that have a lot of joint pain have are higher in acid on the acid-based pH scale, where 7 being the middle, are more towards the acid than they are alkaline. And if they can change usually their diet a little bit, not grossly, they can get a little bit more alkaline, and a lot of the joint pain and inflammatory patterns in the body will go away. But definitely I can help with that. Also, I have treated gout, but as we know, gout has other, like an acidosis type situation, has other factors to it that need to be addressed.
Is Firefly safe to use with other treatments?
Yes, as I mentioned, I am already combining Firefly with my pulsed electromagnet and acupuncture. I would say that it plays well with others. You can use it with any other treatment. I have not had a problem. There's been a few patients that were on photosensitizing drugs, such as if a patient is on a short-term course of antibiotics. We all know that antibiotics make us more, especially a lighter person like me, more susceptible to the sun. So I can still treat, but I would limit the amount of time. But yes, I have not found one machine that it wouldn't work with.
Mm-hmm. And one last question. What type of pain management do you also do at Center for New Medicine?
What type of, okay, the question is what type of pain management do I also do at Center for New Medicine? Mm-hmm. I treat everything. If it's more of a bony structure, or perhaps wanting to, after like a break or a fracture, I would probably use the PEMF. There's more data on that than there is for the light devices. For the soft tissue injuries, I would do both. I'd combine the pulse electromagnet with the Firefly light therapy. And as I mentioned, neuropathic pain, referred pain, show it to me and I can probably help you. I mean, if it's chronic, we're going to take a thermogram and it'll come up and we'll see exactly what the patterns are so we know what we're dealing with.
How long does a treatment take, and what would be the cost for that duration?
Okay. good question. So the question was, how long does the treatment take, and what would be the cost? The cost is $75, and the actual treatment time is 15 minutes. And make an appointment time of 30 minutes just to make sure. Sometimes people run a little bit late. Obviously, doctors can run late. We all know. So the actual appointment is 30 minutes, but it's 15 minutes and it's $75. If it's determined, and this is always discussed with the patient before adding on, and then charging more that PMF, would be a slightly more charge to add some PMF in there if it's more chronic. We charge $150 for a thermogram. So I'd highly recommend, if you have a chronic pain case, of taking a thermogram. Now, that being said, if someone has chronic back pain and they just went and got an MRI, I can go off of that. I don't have to take the thermogram for that. It's more for, like I said, the extremity pain with the referred pain situations when you really want to do a thermogram. And in which case, the first would be $150 plus the $75, and it would be an hour because I would need time to really do a study and take a look at the patient.
How should they prepare before treatment? Like, should they eat before, or?
Oh, okay. Good question. The question was, how should one patient prepare before treatment? There really is no prep for the Firefly. People can receive it day or night while eating or not eating, before or after caffeine. The thermography is a little bit more. Maybe that's what that question was on. But for the thermography, there's a couple pre-image instructions. It's similar to getting a mammogram. The no caffeine, because caffeine vasodilates or opens up the blood vessels, and it can give a false positive. No shaving in the area, and no creams or lotion on the skin. But as far as eating, besides caffeine products, they can eat before have a normal, if they're going to come in, normal breakfast or lunch or whatever.
Well, does anyone have any more questions?
Any more questions out there? Okay, you're welcome to contact me. The email here at the center is info@CFNmedicine, so info@CharlieFrankNancyMedicine.com. And if you, I mentioned again, if you have a loved one, family, coworker, whatnot, or anybody knows anybody that has an actual clinical diagnosis of dementia that's in the Southern California area, in the San Francisco Bay Area, or in the Detroit metro area, please contact me. The study is free for all participants, and so far with our pre-study, we've actually noticed some side effects, in this case being good. We treat over the cranium, and we've had some hair restoration, which was totally unexpected, but very much welcomed by the males in that population. So look forward to it, and I'm excited about it.
All right, thank you so much, Dr. Bales.
Thank you so much for tuning in.
I'll include all the information in the comments below, and if you have any more questions, please email us. Thank you.
Happy holidays.
Happy holidays.